Mitali, being a doctor, there's a lot of taboo around mental health.
The first time when my parents took me to the psychiatrist, they are like, you cannot tell this to anyone. I used to feel extremely sad without any reason. It continued even during my MBBS. I had horrible amount of tremors in my hands and I cannot walk. So one of my colleagues, she is like, you are having PTSD.
When somebody comes to you for consultation, how do you convince them that suppressed emotions, trauma is just as important as them taking medicine?
They are like, आप कुछ भी करो, मुझे दवाई दे दो. Nobody these days wants to work on their lifestyle.
What actually creates excessive cramps in us?
If we are consuming too much of refined flour and processed and sugary foods, so there would be more of a contraction. Okay. And because of that, we are going to feel more period cramps. So we shouldn't be running behind Netflix and chill just like that.
Is there any research that shows us why certain children are born autistic?
Yeah, that has so much to do with mothers, from neurogenic conditions to mental retardation or certain central nervous system abnormalities to the fetus.
Okay, and why does it happen?
Because of nutrition and stress.
Is it true that when people say your biological clock is ticking, you have to get pregnant in your 20s and 30s is slightly late?
Medical gaslighting is real. In female, ovaries are considered as a fastest aging organ. But
oh boy, okay. This podcast is something that every woman and every man needs to watch. We covered multiple ranges of topics, starting from women's reproductive and hormonal health, which includes menstruation, periods, vaginal care, PCOS, PCOD, infertility, contraception, and literally everything, and also the emotional undercurrent that every woman goes through from the time of her menstruation until the time of her menopause. These are actually topics that we were taught to whisper about. But actually, these are the topics that need to be spoken about even more so that we understand what every woman is going through in her journey. Dr. Matali, who's an expert and a medical professional, helped us understand how to deal with this scientifically while also understanding the emotional mood swings that we go through throughout this process. So I highly recommend you watch the entire podcast because it's going to be more like a masterclass for you to understand your own health. So if you're a woman who wants to understand her body better, a partner who wants to be more supportive, or if you're a parent who's raising the next generation, this podcast is for you. Mitali, before we started the podcast, because I went through your profile and we started talking about how you've openly spoken about your mental health challenges and how it has affected you over the years. Can you help us understand what happened?
okay, so this is a bit personal, but I know that is going to help a lot of women, people out there, which is why I opened up on the first place. Okay, I didn't open up to get sympathy from people, but I have seen this in my DMs day in and out that people are finding it really challenging to be themselves or to open about their feelings. So ever since I got sense of myself from the age 6th or 7th, I used to feel extremely sad. I had to push a lot myself to do normal day-to-day activities. Evenings used to be really difficult for me, especially the time after sunset. I used to feel sad without any reason. Okay, I used to cry to sleep almost every single night, and I didn't know how to process my thoughts, how to ask for help. My childhood used to be really difficult. Okay, I don't want to blame anyone that this has happened because of my parents or my grandparents, or it's not. I'm not here to blame anyone, but my childhood used to be really difficult. So initially, I thought that because of those failed relationships or traumatizing childhood events, maybe I'm feeling this because of those events. But it continued even during my MBBS school days, and it continued during my post graduation days as well. It became really significant during my post graduation days when we used to work for 20 hours.
Oh boy.
in out of 24 hours. Okay, for 1 hour I used to spend my time in eating. That's it. And we used to sleep for like 2 hours. Imagine the kind of work life balance that we are talking about. So during those time I used to feel hallucinations, and I used to feel extremely unsafe. So I went and asked for help. So one of my colleague, who is also dear friend of mine, she is like, you are having PTSD, and you have to take medicines and finish the course for like 1 to 1.5 hour. And she was like, because of the medicines you might won't be able to stay awake like the way you are working right now. So I start taking medicines, and those used to put me to sleep, and that was not very comfortable for me. Okay, so I dropped that idea of taking medicine or completing the course. Then 2 years later, when I was passing through a difficult relationship and breakdown sort of a phase, my parents took me to one psychiatrist, and who was practicing since 1975. Okay,
Wow.
so he was like psychiatrist whole his life. Now imagine that we are three doctors, me and my parents. We have dropped that idea of our OPD, because I was crying like anything, and I was feeling that I just told my parents that I want to die. ओके, सो माई पेरेंट्स आर लाइक, हमें कुछ नहीं करना, डॉक्टर के पास चलते हैं, दवाई स्टार्ट करते हैं. So we told all of our patients that this is an emergency situation and we won't be able to attend you today. We went to the hospital, and can you guess how many hours we waited? 6 hours. Okay, after 6 hours, we finally got to meet the doctor. I am sitting here being his patient. He was sitting in front of me at a very far distance. Okay, he looked at me and he was typing something on his computer, and he was like, "Kya hua hai?" So I said that I'm having this kind of thoughts and I don't know what is this. And my parents were crying, and my parents were like, my daughter is trying to kill herself, and she doesn't want to live, and she doesn't want to marry. And it was like a scene sort of a situation. Then he was like, oh yes, you are having depression, and I would advise that you go through my YouTube channel and watch all the videos which status that depressive thoughts आए तो क्या करना चाहिए. I was like, seriously, man, I have waited for 6 hours. And then he prescribed certain medicines at a higher dosages without taking proper history, without drawing any blood work. Okay, now from the next day, it used to be the time of Navratri. Okay, so in Gujarat, Navratri festival is very, very nicely celebrated. So I started taking medicines from the next day onwards, because I was feeling pathetic inside my body. Can you believe, from the day one, I used to sleep for like 16 hours straight. Forget about my practice. I was not in a state to attend any patient of mine. Okay, my parents were like, आप कुछ मत करो, सिर्फ दवाई खाओ and just take care of yourself, we will take care of everything else. Okay, and I used to had horrible amount of tremors in my hands and my legs. In my home, I have my room at the first floor. Imagine the situation that I cannot walk. I used to hold that railing of my stairs, and I couldn't stand, and I couldn't climb and reach up to my first floor. The situation was that bad. Okay, so I took the medicines for like 3 to 4 days, and then I was like, I cannot live like this. I cannot take medicines, and I cannot sleep for like 16 hours. Forget about this depression videos. I couldn't watch a single video of him. Okay, so I was like, I cannot take the medicine that way. I cannot trust any doctor that way. Okay. Now that time passed and I was like, नहीं चलो मम्मी पापा ने बोला है mentally strong बनते हैं. I have to face the world and I just cannot live like this. So I just put my brave foot forward and I was like, ठीक है चलो आगे बढ़ते हैं. Right. And then again I used to feel really difficult time and I used to feel really sad in the evening time and I was like हाँ normally यही feel होता होगा सबको यही लगता होगा because since the time I got my sense of self I used to feel this way only. So इट्स लाइक मुझे पता ही नहीं है कि खुश रहना या नॉर्मल क्या होता है. ओके मुझे लगा सबको ऐसा ही फील होता होगा. देन आफ्टर फ्यू years again those emotions started to hit me again. So I was like maybe now is the time, maybe I should consider taking help. But this time I was like मुझे psychiatrist के पास नहीं जाना है because I wasn't ready to be in somebody's OPD waiting there for 6 hours. I cannot do that. Okay, I cannot watch anybody's depression videos. Like अगर मैं ये situation से pass हो रही हूँ, I want somebody to listen to me, not somebody who is like advising me to watch his YouTube videos. I mean, come on, are you going to say that to a patient who is suffering through depression herself? Are you going to say that you have to watch my videos of depression? So I was like maybe let's just put a brave foot forward and try taking a therapy. So one of my friends, she was also passing through something, so she recommended me to one therapist. So I visited her and I have begun therapy back in the year October 2023. Okay, for the time of 3 months I continued with the same, but no amount of talking that we used to do was helping me at all. Again, I felt like suicidal thoughts kind of overpowered me. After connecting with her for 3 months, it was not at all helping me. So she was like, let's just do one thing, let's just connect with a psychiatrist. So I was like, I cannot go through this
another
same
episode.
cycle.
Yeah.
I cannot watch YouTube's video of some doctor for like, I cannot do this. So she was like, this he has been my doctor as well and he is really going to listen to you and he won't prescribe you medicines until and unless you are going to ask for it, and he is not going to over medicate you on the first place. So I was like, okay. फिर अपॉइंटमेंट मिलने में भी 1 महीना लग गया. And once I started meeting him, he was really kind, he was really gentle, he was sitting across me like this distance the way we are talking. He was not typing something when I talked to him. He was really there to listen and he was actually willing to help back.
How do you feel now?
I'm feeling amazing. ऐसी फील मुझे 32 years में कभी नहीं आई है. I used to always fight with my thoughts. I used to feel really sad. Even with the normal activity, I really had to push a lot. Like, imagine I had to push a lot to eat. I have been always underweight whole my life. One of the biggest reason was this as well. Okay, I have gained my healthy body weight, right? That has been never there in whole 32 years of life. In the past 1 year only, I have gained my actual body weight. I'm feeling amazing. I sleep really well. I wake up fresh. Evenings are no longer fighting battles for me.
It's so brave of you to be speaking about this, right? Because being a doctor, there's a lot of taboo around mental health, right?
Oh my god, you cannot even ask. The first time when my parents took me to the psychiatrist, they are like, हम ये किसी को नहीं बता सकते. You cannot tell this to anyone. In fact, last week only my parents asked me that ये सारी चीज़ें तू इंटरनेट पे बताती है किसी को. Initially, when I began my therapy and medicinal help, my mom found out the medicines one day. So she was like, ये सारी दवाई लेती है, ये दवाई लेने की क्या ज़रूरत पड़ गई है? And despite being doctors, they are like, हाँ अभी ये तो है ही ना, दिमाग से स्ट्रॉन्ग हो जाओ. आई वॉज लाइक, मुझे नहीं पता है दिमाग से स्ट्रॉन्ग होना क्या होता है, मुझे नहीं पता है. यू कंसिडर मी crazy person or whatever you want to consider me, but this is what it is and I have to ask for help because there is no way around and I cannot find any other way. Yeah.
And it's definitely such a commendable step for you, because I'm sure a lot of people who are watching this who are fighting those battles inside them, who cannot come out and speak about that, this is definitely reassuring for them. Thank you so much for sharing that. And we've also seen you speak about how blood tests won't just reveal everything about you.
Yeah.
What do you mean by that?
See, medical gaslighting is real. If somebody is having irregular periods, mostly if they go and visit the gynecologist, they would be like, आप शादी कर लो ठीक हो जाएगा, आप बच्चा कर लो ठीक हो जाएगा, आप 5 kg वेट लॉस कर लो सब ठीक हो जाएगा. So right now it's like when we are young and when we are passing through a certain situation, be it pathological or any kind of situation, initially blood is not going to show us all the abnormality. Like even if you are going to have severe cases of PCOS, there are chances that your FSH and LH levels are going to be normal only.
Okay.
Yeah, so initially your body is going to try and make it normalize only. Okay, so you always have to take it with a pinch of salt, and you always have to try and take proper history. Like the 4 type of PCOS, right? You cannot diagnose that 4 types of PCOS just by looking at the blood report, right? You have to take history, you have to listen to patients and what their symptoms are telling.
So just with the blood reports, it's very difficult for us to actually understand what is happening.
Absolutely. Yeah.
Okay. As a doctor who's predominantly worked with women's health, right? What is it one thing that you really wish people understood better about women, not just biologically, but also emotionally?
I think being a female, it's not that we are hormonal. Okay, we are not going to have mood swings, but the basic thing is that every single week of menstrual cycle we are going to have different hormones, right? The first phase is what we call as periods, then we have a follicular phase, ovulatory phase and a luteal phase. So every single week of a menstrual cycle we are going to feel different emotions. So I wish more and more people could understand that thing.
And can you help us understand all the 4 phases? What exactly happens in all the 4 phases?
Yes, so the first phase is what we call as periods, during which the reproductive hormones, especially the estrogen, progesterone, FSH and LH, it hits the rock bottom. Okay, so during that time, the endometrium lining, which has failed to produce a baby, it is going to come out, right? So that is what we call as periods. Followed by which we have a follicular phase, during which the FSH and the estrogen hormone starts to rise. Somewhere around the mid-cycle, all of the hormones reaches its peak, during which the formation of egg and the release of an egg happens. During that time, if a woman is going to indulge into unprotected intercourse, pregnancy happens. Okay, let's say if pregnancy doesn't happen, then during the luteal phase, there will be predominantly rise of the LH and progesterone hormone. If the pregnancy happen, then there is going to be nurturing of the pregnancy. But let's say if the pregnancy doesn't happen, then again there will be breaking down of that wall, which is called as endometrium, and then again periods are going to happen. So it's like every single week we have different hormones, different activities, different moods, differently how we are going to feel about ourselves, our hunger, libido, how we feel, our skin, hair, every single thing is going to be different.
I mean, this is quite interesting because I don't know how much of this is true, but I read this somewhere where a man has a menstruation cycle which is 24 hours and a woman has it for 28 days. And the working culture is predominantly designed for men and not for women, right?
Yes.
I mean, just help us understand in every week, because it is different hormones that starts to kick in. What moods do women actually go through every single week?
Yes. So, talking about the men predominantly cycle, they have, uh, for men basically, we have only one hormone which is going to surge and fall every single day. Diurnal variation of testosterone hormone. So they have predominantly testosterone hormonal spike. Okay, somewhere around 6 a.m. to 10 a.m. in the morning, they will have surge in the hormone testosterone. Somewhere around the middle of the day, there is going to be little fall. Somewhere around the winding down time of the day, means after the evening and night time, again the testosterone hormone is going to fall. Second, you asked what?
For the women, every
The
week, what are
Yes.
the emotions that we go through?
Yes. So today marks day 2 of my periods, and I'm feeling really, really great. Why? Because during the initial part of the menstrual cycle, we are going to feel extremely agitated and irritated, and the energy levels falls during the first half of the cycle.
When you say first half, that is before the period,
No,
during the
during the
period. Okay,
periods.
the first day. Okay.
Yes, yes. From the second, third day of the period cycle, there is going to be surge in the FSH and estrogen hormone. Okay, so from the second, third day onwards, for myself especially, I do feel great after second and third day. A week prior, my periods is going to be extremely sensitive for me, and I'll feel irritable and बिना बात के रोना आ जाता है and
That is
those
the
kind of.
PMSing phase.
Yes.
Okay, and help us understand what is PMS, because uh, when I got my period, the initial few years, I probably did not go through any cycles of fluctuation in emotions. But when I actually got to understand what PMSing was, I'm able to see how my emotional turbulence happens 1 week before the periods. Help us understand what is happening inside the body of a woman.
Okay, so somewhat 7 to 10 days prior our periods, there is going to be fall in the level of estrogen, and there will be little rise of the hormone progesterone. Okay, so because of that hormonal fluctuation that happens, that can lead to certain changes in the mood. There will be little low in the levels of the bowel movements, which means you are going to feel little constipated. Your energy levels are fall. You are going to feel little irritable, agitated sort of a thing, and you are going to have sugar or salt cravings.
Okay. Why does this happen? Because the estrogen level falls down.
Yes.
So, what is that I can do physically to make sure this PMSing, that phase is not this bad?
Okay, so rather than just going into that hush hush phase कि हमें सब कुछ करना है, I want to do it all, maybe you can find out little moments to rest it out. If not, because see, we are not getting any paid menstrual leaves or PMS leaves or any such kind of leaves, so maybe we can ask for a little amount of what can we say, pause moments or some amount of breaks in our day to day life, and sleeping properly on time, like we shouldn't be running behind Netflix and chill just like that. So 7 to 8 hours of deep restful sleep, always listening to our cravings, like I do have salt cravings during my PMS time. Majority of women, they do have salt, sugar cravings. So maybe listening to what our body craves for, and then prioritizing proper meals in a day, balanced meals, well balanced meals that includes proper portion of vegetables, pair it up with good source of protein, because in India it's like we are living in a love hate relationship with carbohydrates, and we are not having well balanced meals that contains proper protein amount. So maybe prioritizing that, proper maintaining hydration, managing stress, that helps.
All right. So, is there any specific food that we can take so that this entire journey is not that difficult for us?
Absolutely. So foods which are rich in omega-3 fatty acids, like nuts and seeds, salmon or seafoods which are rich in omega-3 fatty acids, and magnesium containing foods like certain pulses like rajma, uh, and magnesium rich foods like some amount of seafoods and any kind of supplements which are rich in magnesium, so they do help.
Okay. So now you spoke about how hormones truly impact the four phases of us going through a menstruation cycle. In this entire thing, what are endocrine disruptors?
Okay.
So I want to understand what all can cause the disruption in the hormones in our body.
Yes. So endocrine disruptors are specifically derived chemicals which acts along with our hormonal receptors. Like if I want to give you an example, let's say we have certain skincare products or floor cleaners or hand washes or laundry detergents. So this kind of perfumes, for that matter, cosmetics, these things, they have certain type of chemicals which acts along with our hormones, and they compete with our hormones inside our bodies, and they attach on the same kind of receptors where our hormones are going to attach, and they have specific kind of actions. Okay, so if we have to commonly ask, we have BPA, plastic BPAs, dioxins, then what, plastic BPAs and dioxins are most common. Certain fragrances. Yeah. So those things are called as endocrine disruptors.
So when we use this, for example, let's say I'm using a perfume which probably has all of these, what does it do to my body?
Okay, so whenever you are applying it to your body, they will compete with those estrogen and progesterone hormone in your body. And because of that, your natural hormones which are produced by your bodies, they aren't going to work properly.
Okay.
And because of which, the natural function which usually happens in your body, like ovulation and formation of the endocrine and the formation of endometrium lining and everything, that doesn't takes place. So that can lead to certain hormonal conditions.
Can this also lead to infertility?
Yes.
Okay.
Thyroid conditions are most commonly seen with the plastic BPAs and aluminum foil which we use to eat.
Oh boy. Okay. So now, Mitali, help us understand what a healthy period can look like in terms of flow, in terms of how we feel in the body. What does a healthy period look like?
I love this question. And this question made me realize that I should start creating content
around this.
Yes, because one day I was meeting patients in the OPD at state government hospital, and one young girl came and she was like, I'm having periods for 6 days and my friends are having periods for 5 days. So is it normal? Why I'm the only one who is having it for 6 days? And then I made her understand everything. So I was like, if I can make her understand that this is what normal looks like and this is what normal feels like, maybe there are a lot of other women out there who are not able to understand these things. So
Right.
maybe I can help that.
Right.
Yes, so coming back to the question, normal periods, they show up at a frequent interval of 28 to 37 days. If somebody is having periods at a frequent interval of 28 days, that is considered as normal. 37 days, that is also considered as normal. Blood flow could last from 3 to 7 days. Okay, if it lasts for 3 days, normal. 4 days, normal. 5 days, normal. 6 days, normal. 7 days, normal. The blood flow is going to be somewhat around 30 to 70 ml. Now you must be wondering कि एक एक बूंद थोड़ी ना गिरने जाएंगे. So इसके लिए भी we have a mathematics. Let's say if you are using a menstrual cup, okay, the outer surface of menstrual cup shows markings like 15 ml, 16 ml, 20 ml, that way. So if you are a menstrual cup user, you can easily find it out how much amount of blood that you are losing. Okay, let's say if you are using a pad, okay, so a regular size pad is going to hold somewhat 7 to 10 ml of menstrual blood. Okay, so let's say if you are using 3 pads in a day or 6 pads in 2 days, so depending upon which you are losing somewhat, if 3 pads in a day, approximately 25 to 30 ml of menstrual blood. Okay, now we have something called extra large pads and double wings and 4 wings and maxi pads, those extra absorbent ones. They are going to hold somewhat 12 to 13 ml of menstrual blood. Okay, so depending upon how many pads we are using in a day or night, we can make a note of it that I have used 5 in the last 24 hours. So that way we can make the calculation. If you are someone who is using tampons, so a regular size tampon is going to hold somewhat 6 to 8 ml of menstrual blood. So depending upon how many amount of tampons that you have used, you can easily figure it out that how much amount of blood that you are losing. Along with that, normal period feels like of course you are going to feel that your energy has drained. आपको ऐसा लगेगा कि मुझे बस सोते रहना है. There are few group of women who are going to feel extremely hungry during periods. There are few just like me, we get food aversions कि नहीं मुझे तो कुछ खाना ही नहीं है, I just want to sleep like that. But the basic thing is that you are not going to have major cramps. Like if on the intensity of 1 to 10, 1 means least painful and 10 means most painful. If the cramps hit the intensity of 1, 2 or 3, that is considered as normal. More than 5 is not considered as normal.
Okay.
Yeah, so if you can routinely, regularly performs your regular activities, your day-to-day activities, that is considered as normal. But if it's like you have to just pop medicines to go about your day and you are passing too much clots or something like that, then that is not considered as normal.
So what actually creates excessive cramps in us?
Yes, so as you know, period is considered as an inflammatory activity inside our body. Okay, the 4 phases of menstrual cycle that we have discussed. First phase is what we call as periods. Now during each menstrual cycle, our body gives us chance to get pregnant. Okay, every single month when we are in our 20s, we get 20% chance to get pregnant. Okay, so our body is like every single month it prepares everything for body, like the endometrium lining, egg, to meet the sperm and everything. Now let's say we are not going to do intercourse every single month. So during that time, the endometrium lining, which has built to nourish the baby, that is going to come outside the body. Okay, so during that time there are certain inflammatory mediators which increases inside body. They are called as prostaglandins. Okay, prostaglandins are of 2 different types. First one is called as prostaglandin F2 alpha. They are the contractile ones. They will squeeze the uterus. Okay, and we have relaxing ones which are called as prostaglandins E2. They are going to relax out the uterus. So in between the contraction and retraction sort of activities, when the contraction happens, we are going to feel the pain inside the uterus. This is the specimen which is there inside our pelvic cavity. Okay, this is uterus, cervix, vagina, 1 pair of fallopian tubes and 1 pair of ovaries. Okay, so if we are consuming too much of processed foods or consuming endocrine disruptors like in our routine day-to-day life, so there would be more of a contraction. Okay, like if we are consuming refined flour and processed and sugary foods, so there would be more of a contractile prostaglandins as compared to the relaxing ones, and because of that we are going to feel more period cramps. That is also called as a spasmodic dysmenorrhea.
Okay, so generally during period cramps, I've seen a lot of my friends do that. They use tablets to get over the pain.
Yeah.
How harmful is that for the body?
Actually, they are life-saving.
Okay.
Yeah, I am going to say that personally for myself because my mom used to had spasmodic dysmenorrhea, means severe period cramps during her teenage and early 20s. And I also had the same amount and intensity of period cramps. Means if on the scale of 1 to 10, if 1 is considered as least painful and 10 is considered as most painful, I used to had like 100 by 10.
Oh boy.
That intense period cramps. Okay, so I used to had severe spasmodic dysmenorrhea along with nausea, vomiting, diarrhea, and I used to just roll on the floor, like, plus passage of clots and blood used to be heavy, so it used to be really difficult, right? So for such severe cases of period cramps, medicines are considered as life saving because you cannot rest it out for whole 5 days every single month.
Right.
Yeah.
So, I mean, the overdosage of that does something to our body?
Okay, so most of the available drugs in the market, they act for like 6 to 8 hours
Okay.
during the day. Okay, so if you are consuming 2 to 3, that is considered as a therapeutic dose.
Okay.
So that won't have any significant impact on your fertility or blood flow. Okay, like we have two different types of medicines which are available. First is called as antispasmodic, so that will help with relaxation of the uterus part. Okay, the painkillers one, so they won't have any significant impact on your ovaries or future fertility. Okay, but if you are consuming medicines which contains tranexamic acid or ethamsilate, so that will have a significant impact on your release of blood.
Okay.
So that will have scanty cycles, but besides that, that won't have any long term or short term impact on your fertility or impact on your kidneys or bladder or something like that.
Okay. So it just brings me to the next question where, I mean, we've heard this so many times, right? Our grandmothers and great grandmothers had like 8 children, 10 children, and they
Yeah.
were still healthy and they were able to go about their lives very normally. But this generation, one, because of PCOS, PCOD, and a lot of fertility issues, what do you think is the actual problem right now?
Okay, so most of the people, they choose to believe that PCOS, PCOD is a recent issue, like it has been diagnosed just like that. But that is not true. PCOS was first diagnosed in 1930s. Okay, so there were two different people. One is called as Stein and second is called as Leventhal. There were two people who studied women who are having amenorrhea, means उनको periods नहीं हो रहे थे, and when they did surgery they found that their ovaries were swelled up, तो उनकी ovaries में swelling हो गया था. Now they did the debulking surgery. So imagine that if this ovary is a bulky one, they cut it into the half. Okay, after the debulking surgeries, all 7 women, they had their periods. Okay, now they were studying on those same group of women कि इनमें आखिर हो क्या रहा है. So during their studies they found out that those women are having obesity. Central obesity means deposition of fat somewhere around their mid portion and somewhere around their waist area and the hip area. Okay, so gradually they found out that obesity and amenorrhea are linked, and then they found out that this condition is what we call as PCOD, polycystic ovarian disease. But later somewhere around the 90s and early 2000, they found out that this has linked with certain amount of hair growth, temporal baldness, male pattern hair growth, central obesity, and every single part of the body is affected. So initially it was labeled as PCOD, polycystic ovarian disease, but later they found out that this has linked with every single part of the body, like from head to toe it has linked with so many other systems. So they labeled it as a polycystic ovarian syndrome.
Okay, so what is that actually? What happens in the body? What happens in the reproductive parts?
Yes, absolutely. So, as you know, the menstrual cycle is divided into 4 different phases. Now, during the ovulatory phase, let's say if in the body at a regular interval when that hormone has to release, it doesn't releases. Okay, so because of which the ovulation doesn't happen. अगर ovulation नहीं हो रहा, so those immature follicles collects over the surface of ovaries. Okay, so because that ovulation is not happening, ovaries are going to convert into bulky ovaries. Okay, and the peripheral part of the ovaries, they contain certain amount of immature follicles. Okay, so that is what we call as PCOS, which comprises of 3 group of symptoms: amenorrhea or absent periods, polycystic ovaries, that is the second part, and scanty cycles.
And how much of an impact does mental health have on all of this?
So much impact, right? Because adrenal type of PCOS or a lean PCOS is directly linked with stressors, right? So if you are running on a chronic loop of cycles of stresses, that can lead to anovulation. See, again, I would like to go back to that theory of 4 different phases, right? The first phase is what we call as periods: follicular phase, ovulatory phase, and luteal phase. The last half of the menstrual cycle after the ovulation period, that is what we call as luteal phase, okay, which is predominantly governed by the progesterone hormone. Okay, if you are running on a chronic stress cycles, the cholesterol which is present inside body, that gets converted into either progesterone hormone or cortisol hormone, which is also called as stress hormone. Okay, so if you are on too much of stress, the cortisol hormone is going to get formed from the cholesterol which is present inside the body. ओके, तो अगर आप स्ट्रेस ले रहे हो तो आपका प्रोजेस्ट्रॉन हार्मोन बनेगा ही नहीं, which is directly linked with formation of your endometrium lining and which is directly linked with the fertility in case of a woman and the nourishing and the nurturing part of the pregnancy if that happens at all. Okay, so if you are too much stressed तो वो बनेगा ही नहीं. So that has so much to do with the phases and the growth of the endometrium and the fertility part.
Okay. Is it true that when people say your biological clock is ticking, you have to get pregnant in your 20s and 30s is slightly late? Help us understand the science behind this.
Okay, so this is very interesting and my favorite topic to discuss. Okay, in female, we have ovaries. Okay, ovaries are considered as a fastest aging organ. Okay, now when we were in our mother's womb, we had millions and millions of follicles inside our ovaries. Okay, but when we are born, we are going to left with few millions of follicles. Okay, now ovaries, ये दो जो है, that is considered as a fastest aging organ. So till the age we reach our first period, ovaries are going to left with only few million follicles क्योंकि aging हो रही है. So if we are indulging into unprotected intercourse in our 20s, we have 20% chance to get pregnant every month. Okay, now when we enter our 30s, that chance falls somewhat between 15 to 17%.
Okay.
Mid 30s, 12 to 15%. Early 40s, that will be somewhat around 10 to 12%. Mid 40s, 5 to 7%. So that aging is real.
Okay. So is freezing the eggs healthy then?
Yes, the earlier you do that, the better it is. But see, I'll just give you a simple example. Let's say I want to freeze my eggs and I am in my early 30s. Okay, so what my fertility doctor would do, they'll put me on certain injections, they'll retrieve the egg out of my ovaries and they are going to freeze them at a sub-zero temperatures. Okay, now imagine that I have crossed my mid 30s, now I have found my husband and after 1 or 2 years I want to get pregnant. Okay, so my eggs are frozen at a sub-zero temperature, so eggs are young and viable that way, but they are not freezing my whole uterus.
Correct.
Right, they are not. So if I am somebody who is not taking care of my lifestyle, because my uterus is still aging, right, if I'm having like pre-diabetic state, abnormal glucose levels, abnormal cholesterol levels, if I'm running on constant stress, so in that case the chances of first trimester miscarriages, second trimester miscarriages, preterm baby, gestational diabetes mellitus, preeclampsia, all of these condition increases.
Okay, so no matter you freeze the egg, don't freeze the egg, keeping yourself healthy is the primary thing that we've got to do.
Absolutely.
Okay, that's quite interesting. So now I want to understand from a mental health perspective. So do you believe the unhealed trauma and suppressed emotions in our body can lead to PCOS or PCOD?
Absolutely. See, it is not written in any research paper, but suppressed emotions, that has so much to do with hypothyroidism and thyroid conditions as well. Like if you are somebody who is not vocalizing your feelings properly,
Yes.
that can lead to certain thyroid conditions. Yes, and that has so much to do on your root chakra and sacral chakra as well, which are linked with the pelvic system, the pelvic inflammatory conditions.
So when somebody comes to you for consultation, right? Because you're a doctor, somebody who believes majorly in science, how do you convince them that suppressed emotions, trauma, all of that is just as important as them taking medicines?
So majority of patient who come to me, they are like, आप कुछ भी करो, मुझे दवाई दे दो, दवाई से ही सब ठीक करना है. Nobody these days wants to work on their lifestyle. Nobody is ready and willing to accept their unhealed trauma or feelings or emotions.
So when somebody comes to you to get pregnant,
Yes.
let's say they drink and they smoke, the woman drinks and smokes, how many months before would you ask them and recommend them to stop both of it?
6 to 8 months.
Why? I mean, what does drinking and smoking do to your health?
Okay, so drinking has so much impact, firstly, on the eggs number of follicles. Even the quality of follicles, they do impair as well. It has so much to do with number of sperms. So pregnancy is a two-way street, right? So we would advise for both the partners that they should stop drinking and smoking at least for the span of 6 to 8 months.
So now let's say somebody is pregnant and they end up drinking. What will happen?
That can lead to fetal alcohol syndrome. So it will have impairment on the fetus, like from neurogenic conditions to mental retardation or certain central nervous system abnormalities, certain bone deformities, certain eye conditions, and metabolic condition to the fetus as well.
Is there any research that shows us why certain children are born autistic?
Yeah, that has so much to do with mother's nutrition or how and what kind of stress that they are passing through during the pregnancy.
So it's
and
majorly
pre-pregnancy.
nutrition and stress.
Yes.
Okay. So next thing I want to talk about is something that most even women just feel either shy or ashamed talking about, right? The vaginal care.
Yeah.
And you've been speaking about that so beautifully on your channel, where it gives a lot of information. Help us understand how to take care of the vagina.
Okay, so the first and most important part is that majority of women, they don't know where actually the vagina lies. Okay, so if we look into this specimen, this is uterus, this is cervix, which is called as mouth of the uterus, and this is vagina. Vagina is like a 4.5 to 5 inches canal, and the external part, which is not seen here, is what we called as vulva. Okay, so vagina is considered as a self cleaning organ. इसके अंदर साबुन, पानी या कुछ भी डाल के वॉश करने की ज़रूरत नहीं होती है. द आउटर पार्ट दैट इज़ कॉल्ड एज वल्वा, विच हैज़ 3 openings: the urethra, vagina, and the anus. That requires proper cleaning. So just by separating 2 outer and inner lips of the vulva, anybody can wash it properly through normal water, lukewarm water, or non-scented soap.
Okay. So now when we talk about the white discharge, what exactly is white discharge?
Okay, cervix secretes certain amount of discharge, and the vagina, it has certain glands which secretes the discharge. That is what we call as white discharge. That is one of the way of making the vagina and vulva part clean. Healthy vaginal discharge is somewhat 2 to 4 ml, whitish to opaque white to, like this vaginal discharge, it changes in different phases. Like I'll just explain it as well. Okay, so when we were on our periods, there won't be any white discharge because we are absolutely secreting the menstrual blood. Once the periods are over, there is going to be 2 to 4 ml of healthy vaginal discharge, which is going to be egg white in consistency. Okay, somewhere around the mid cycle, the amount of white discharge is going to be more. Okay, now ये more वाला concept किसी के पास है ही नहीं. So if anybody is having more vaginal discharge, they'll be like, oh, I am having leukorrhea, oh, I am having infection, oh, I am losing protein and calcium and magnesium from my body. But that is normal and physiological discharge. So that is what normal looks like. Abnormal means if the whitish discharge amount is very much in amount, except these three conditions. Okay, if it is greenish, whitish, yellowish, brownish, present with foul smelling or abnormal amount of itching, that is what we called as abnormal kind of a discharge.
Okay, and why does that happen?
Because of infections, bacterial, mixed bacterial or fungal type of infections.
Okay, so how do we avoid these kind of infections?
By properly taking care of our routine hygiene, menstrual hygiene, and intimate hygiene.
So when you say intimate hygiene, is it important for us to use a vaginal wash to wash it off, or normal water is fine?
Normal water and non-scented soap, they are fine.
Okay, okay, got it. And during the periods, right? So now there are sanitary napkins, there are period panties, there are tampons, menstrual cups. What do you think is the best one for somebody to use when it comes to hygiene?
Okay, this is a tough question to answer, but considering everybody's preference and comfort, I would say pads which are made up of natural fibers, they are considered as normal and comfortable to use. Okay, because see, menstrual cups are considered as a penetrative device which you have to insert it inside, and teenage or young girls, they are not very comfortable inserting something down there, and they just feel it really gross when it comes to touching the period blood, because taboo and stigma are still there.
So when patients come to you, right, despite the kind of information and awareness that is there, what are certain myths that are still there around periods and menstruation that you're truly fed up of?
The first and most important is untouchability. Like, I have seen in many communities where there is like so much of taboo and stigma that the menstruating woman is not allowed to enter inside their kitchen. They'll just ask them to go outside their house and or be there in their home, in their own room. Like the untouchability is up to that extent.
And when we speak about intercourse and sex, right, why do you think some women experience a lot of pain during the process of sex?
Okay, so you would agree with me on this, that the way word sex has introduced in our life is very different.
Yes.
Like the way first sex word has introduced in our lives. किसी ने ये नहीं बोला है हमें that this is going to be a pleasurable one. Imagine कि आप कभी बर्फ देखने नहीं गए हो. Okay, now I have been to Kashmir, so I'm going to tell you that this is how the snowfall happens, and you are going to feel that cold, and you are going to feel this and that. Now that has created certain pre-decided notions or beliefs in your brain.
Yes.
Right, so whenever you are going to go to Kashmir or any place which has a snowfall, you are going to feel those same feelings because I have described that to you. The same way, every single woman who is going to enter into their intimacy journey, they have told these kind of things, right? That this is going to hurt and you are going to bleed like this, and so nobody has ever told us on the first place that this is going to be a pleasurable activity. So because of which the pain thing is there.
And also, how do women get over this mental block?
By taking charge first, second by educating them, so they should start learning about their anatomy, and then by self exploration. We have a lot of taboo around masturbation,
yeah.
right, in men also, around women also. They'll be like कि if the white discharge or amount is going to be there, you are going to lose protein, you are going to lose calcium, your blood you are going to have scanty cycles. Eventually, you are not going to produce babies because you are masturbating.
So now when we spoke about the hormones, right, the 4 phases, does it also affect the way we feel during the day?
Absolutely.
In which phase do we feel the happiest?
Ovulatory phase, when all the hormones are at peak.
Okay. So now, do you think we should start prioritizing our days and work according to the phases?
Absolutely.
So then help us
100%.
understand, like, what are the things that we can do in all the 4 phases?
Okay, so when your periods are there, I can understand we are not having paid period leaves or something, but maybe we can ask and inform our colleagues to help us as much as possible. Maybe we can work from home during those days, or if nothing happens, maybe we can plan short breaks, something like that. So let's say if I'm having my periods on 1st of April to 5th of April, so maybe from 1st to 5th of April, maybe I can prioritize myself more rather than working. Okay, I can also plan out my breaks or shorter breaks or something like that. From 6th of April up and until 24th of April, those 3 weeks I can push myself, I can work like anything, I can indulge into HIIT workouts, resistance training, cardio, cycling, gymming, swimming, whatever kind of activities that I'm comfortable with. And then again, 1 week prior to my period. So from 25th of April up and until next cycle, that week is considered as very sensitive. So maybe again, I can prioritize my self-care, maybe try and take afternoon naps, sleep little extra, or listen to my cravings, something like that.
And is it okay for us to exercise during our periods?
Yes, it is okay, but you would agree with me that, let's say, if I'll give you that example only. Let's say I'm having my periods from 1st of April. Okay, so initial first, second, and third day, I'm going to have more of a blood flow. Right? So if the blood flow is there, if I'm energetically not feeling good, maybe I can indulge into low intensity workouts like yin yoga, pelvic opener, or a hip opener type of a yoga. It works brilliantly. Okay. Or if I'm feeling good, then maybe I can indulge into grounding or brisk, not brisk, but slow kind of walks and relaxing part and stretches.
Okay. Now, next coming down to, why do people use panty liners and when should people use panty liners?
Okay, so during the 4th and 5th day of your cycle, when the blood flow is less, so during the less bleeding days, or just to soak up the excess white discharge, women are going to use the small pad, which is called as panty liner.
I also saw the contraceptive, that box inside.
Yeah.
Can you help us understand how,
Yeah.
the eye pill? Just explain this to us, please.
Okay, so we have two different types of contraception which is available. The first one is called as regular contraception, and second is what we call as emergency contraception. Okay, so let's just imagine that in the heat of the moment, a couple has done something, or in the they were using, the second scenario is that, let's say, they have used condoms or a regular contraception, but they have noticed the tear in the contraception. Okay, so this is the emergency contraceptive pill, which contains levone or gestrol hormone in 1.5 milligram. Okay, so क्या होता है इससे? When you are going to take this within the 72 hours of unprotected intercourse, that inhibits the meat of the sperm and ovum. It inhibits the ovulation process as well. It thickens the cervical mucus, and even if the egg and sperms are going to meet, the pregnancy doesn't happen. Okay, so that is what it does.
Does it have any side effects?
Absolutely. Nothing comes without side effect. Every single medicine which is available on planet Earth has certain amount of side effects. Okay. So it has short-term effects and long-term effects. Short-term effects like nausea, vomiting, acne breakouts, thickening of the white discharge. Long-term effects are going to be changes in the blood flow, color, and consistency of period blood, which could last for 2 to 3 cycles.
But when somebody takes this regularly, what does it do to the body?
One should not take it regularly because this is emergency contraception.
Okay.
Emergency for the reason. Okay. It will have impact on your menstrual cycle. It will become irregular. You are going to have scanty cycles for like whatever long time of period that you are taking it. So let's say if I am taking this in the month of April, the effects are going to be there for as long as 3 cycles.
Okay.
So uh, till the July month, I might have irregular cycles. Blood flow, color, and consistency is also going to get changed.
So help us understand how to use a condom the right way.
Okay, so first and major mistake which almost everyone does unknowingly is they store it inside the pockets, okay, or inside the wallets. One should never store it there, because of the temperature, the chances of tear increases significantly. So maybe they can put it inside their bag or something like that. Second mistake most amongst us do unknowingly is that they just tear down the outer packet of the condom with teeth, like ऐसे तोड़ते हैं. One should never do that,
Why?
because unknowingly you are also damaging the outer latex of the
Okay.
condom.
Okay.
Okay. Third thing is that there are a lot of couples in the heat of the moment, they just try rubbing genitals prior putting a condom. Even the pre-cum which is present on the glans penis has chances for us to make pregnant. Pre-cum has certain number of sperms in it. So prior making any genital contact, one should put a condom on.
Okay.
Okay. And last but not the least, immediately after taking the penis out, maybe they should hold condom from the base of the penis. Okay. And then they can remove the and then they can make the penis out of the vagina.
Okay.
Yeah. And last but not the least, they have to examine the condom under the running water, that if there any tear or any abnormal scratching or something is there on the surface of condom or not.
Okay. Got it. And help us understand about the copper T.
Okay, so this is called as copper T, which is also called as intrauterine contraceptive device. This is like inserted in the OPD from the cervix, and it is going to be kept here somewhere like this. So copper Ts are act in two different ways. First, the copper which is present inside the copper T that creates inflammatory condition inside the uterus, the endometrium lining, and these two arms of the copper T are going to be there somewhere here. So it creates a barrier between the sperm and egg.
Okay.
It's like sperm और egg के बीच में copper T का आर्म आ रहा है.
Okay.
Yeah, so that way the pregnancy prevents.
Okay. And the other one, the pap smear?
Yeah, so just a minute. This is the model of the uterus. The mouth of the uterus is what we call as cervix. Okay, cervical cancer is the most prevalent cancer which is there in India, which is why to make the diagnosis early from the age 21 to those who are sexually active and not active, they should get the pap smear done, into which a lady is asked to lie down from inserting, and then doctor is going to insert the speculum inside the vagina to push down the lower vaginal wall, and they will take the smear like this. They'll take the smear of cervix, put it over a slide from the brush, and this ice cream stick like this, and they'll examine it under the microscope. So if any abnormal cells are there, they'll be easily able to find it
So
out.
how frequently should you be doing the test?
From the age 21, every 3 yearly basis.
Every 3 years.
Yes.
Okay. So what according to you safe sex other than just preventing pregnancy?
Safe sex means not just preventing pregnancy, but preventing sexually transmitted infections as well.
Okay.
Like chlamydia, gonorrhea, syphilis, HIV, HBsAg, herpes, HCV, those kind.
Okay. So, I mean, what is safe sex then? I mean, does someone always use a condom, or how does it happen for us to have safe sex?
See, if somebody is using a condom, that covers the penis part majorly. Okay, still the scrotum and vulva are not covered fully. So even if you are using a condom, you are going to prevent 95% of sexually transmitted infections, but not all.
Okay.
Yeah. Not everybody is aware of this fact.
Okay, yeah. I mean, this is quite shocking. So, generally, in order for us to prevent sexually transmitted diseases at all, what do we do?
To
To prevent,
prevent
yes.
the sexually transmitted infections.
Yes.
Of course, use a condom. That is the first thing. Second is what we call as HPV virus, the human papilloma virus, that is linked with the cervical cancer, cancer of the back of the throat, anus, penis, vulva, and vagina. Okay, so we have a vaccine which is available, the HPV vaccine. That is very important to take. 3 dosages are there. Anyone can take that vaccine, and imagine we have a vaccine that prevents cancers.
So the next question comes from my own experience. So last year, when me and my husband were thinking about a pregnancy, we wanted to go consult a gynecologist to just understand how healthy we are, what we can do in order for us to get on the path of becoming pregnant. It was so shocking for us because the minute we went and met the gynecologist, the first thing that she said was, go get this test done, go get this test done. And she wanted to put us on IVF. Even without understanding what our requirements were, if we were healthy or not, it was quite a shocker for us. And then we decided not to go to that gynac. After that, we started to go to a different gynac. Do you think there is a lot of push into patients going into IVF these days?
If you see in Ahmedabad, at every other crossroad, we have other IVF hospitals.
Yes.
IVF centers are like flooding, right? And these days, people, especially couple, are like, हमें बच्चा चाहिए अभी करके दे दो. So nobody is having that patience on the first thing. Second, our lifestyle has become like that we are living under so much of stressors, endocrine disruptors, irregular cycles. So the fertility is also on the fall, the one way or another. Okay, so that way, yeah, we have patience factors as well and gynecological factors as well that push us to more of a fertility treatment side.
So when a woman goes through the IVF treatment, there's a lot of emotional turmoil that she goes through.
Absolutely.
Can you help us understand why that happens?
Okay, so we have different types of IVF treatments, the artificial reproductive techniques. Okay, the first one is the simplest form from begin with. We have something which is called as a follicular study. So they will measure the amount and number of follicles that gets matured every single month. Okay, and it begins with ovulation induction or ovulation stimulation drugs that will stimulate our ovaries to produce more eggs. Okay, so whenever I'm giving that kind of a drugs, instead of one, my ovaries are going to produce more number of eggs. Now, for those ovaries to release egg somewhere around the mid-cycle, we give one injection which is called as HCG. Okay, so it's like you are giving or stimulating ovaries from external end and you are giving injection to release egg. So it's like there are a lot of hormones which we are giving from external end. So that has 110% mental turmoil. Second is what we call as IUI, intrauterine insemination. To those patients who are having low sperm counts, they are going to go through the procedure of ovulation study, plus somewhere around the mid-cycle, husband is going to give his sample, this semen sample, through the process of masturbation, and they are going to put it here somewhere around the cervix, somewhere around the mid-cycle. So because there are more in number of sperms are going to enter the cavity, the chances of pregnancy are going to increase. Okay, now the third thing is what we call as IVF, the in vitro fertilization. Let's say if we have a sperm factor or a tubal factor or a ovarian factor, so if we are doing IVF with using a woman's egg and a husband's own sperm. That is what we called as IVF, of using their own gametes. कि हमारी बॉडी में जो है वही हम यूज़ कर रहे हैं. Let's say a woman has entered in her 40s, and if we are using donor eggs, कि उनकी एग क्वालिटी अच्छी नहीं है, नंबर भी नहीं है ज़्यादा, and because at 40 we are like at the last stage of ovarian reservation failure sort of a situation. अभी menopause आएगा, अभी सारे eggs चले जाएंगे, those sort of situation. So maybe we can try and take donor eggs, and using husband's sperm we try and fertilize from external end, and we are going to put it inside the uterus. Okay, now to support that pregnancy we have to inject so many hormones. Okay, because it's like it is not an easy thing for the first place.
Okay.
Yeah, so a hormonal roller coaster is going to be there, emotional roller coaster is going to be there.
And when you said we're going to take, for example, let's say we're taking the egg from a donor, right?
Yeah.
Will the body reject it because it is not the body's?
No.
It won't reject. And the second thing, the genetics of the child is of the donor?
Yes.
Okay, so what do you check generally from a donor egg? Like if it is healthy, like genetically, what all do you check?
If any chances of genetically abnormal tests are also there or not.
So that is being tested and then the donor is chosen.
Yes.
Okay.
Yes.
So typically the mother's DNA and genes are not passed on to the child.
No.
Okay.
Up to an extent, yes, but the core gene functions are going to be of the donors.
Donors. Okay. Okay, this is something I wanted to ask you. What would you say to a woman who feels embarrassed to ask her doctor questions about her body?
I would say मैं आंखें बंद कर लेती हूँ. ऑनलाइन कंसल्टेशन है तो आई वुड से कि मैं कैमरा बंद कर लेती हूँ. आई वुड जस्ट ट्राई एंड calm herself down, because it's really difficult to open up to somebody, even if that is a lady doctor. थोड़ा मुश्किल हो जाता है, because these things are really personal. And we have so much shame, fear and stigma attached to, vulva and vagina and all the conditions which are related to our reproductive health.
So when patients come to you, do you have patients who are extremely shy, or they just don't want to like reveal themselves and show to you even during a consultation?
Absolutely.
And what do you do?
I just try and talk to them for like 5, 10, 15 minutes. Yeah, and outside patients are like, ये कितनी बातें करते हैं, हमारा नंबर कब आएगा? So I just try and calm myself down, and then eventually they open up.
Right. And what's one thing you wish women were taught in school about the reproductive or hormonal health?
Everything. Like, जब तक मैं मेडिकल स्कूल में नहीं आई थी, I didn't have idea about the proper menstrual cycle. Okay, in the name of period education we were taught कि पैड ऐसे रखना है, and we were given iron tablets once in a week. ठीक है, कि हफ्ते में एक बारी they ask all of the girls to come outside the class, and those brownish pills which used to smell really weird. Okay, कि जैसे हाथ में लेते ही इतनी गंदी स्मेल आ रही थी. most amongst us used to just throw it away. कि कोई देख नहीं रहा है तो फेंक देते हैं ऐसे करके. So in the name of period education, those were the only things which were taught to us. These things are not taught to boys of the class.
Right.
कि सबको साथ में बिठा के नहीं सिखाया था. Even the reproductive chapter was taught in a very weird way. कि बोला है कि they used to just ask us to read it down, and if we have any questions we can ask them.
Exactly. I still remember the boys were sent out of the class, only the girls were sitting, and we used to get the lectures, and boys were very curious as to what was happening. It was such a taboo since then, right?
Absolutely.
I mean, you think things are changing now?
I think yes.
Okay.
Yeah.
A lot of people have started to talk about it.
Absolutely.
If you could give one piece of advice to every woman listening, something you wish you were taught early, what would that be?
I would give them that don't suffer in silence. Okay, be it your painful periods. I mean, I do remember that when I used to had painful periods, one of my maternal aunt told me कि I would just say in exact words, ठीक है, ताकि सबको पता चले कि इसकी डेप्थ क्या है. शी वॉज लाइक, अगर अभी इतना नहीं सहन कर पाएगी तो आगे जाके बच्चा कैसे करेगी. So I would say whether it's painful periods, painful sex, or any kind of pain that you are passing through, don't suffer in silence. Okay? It is not normal, it is not normal, it is not normal.
The next bunch of questions I'm asking you is for us to get solutions or tips or suggestions in that. What are three simple things women can do every day to keep their hormones and mood balanced?
7 to 8 hours of deep sleep, 120 to 130 minutes of active workouts in a week, and having 3 balanced meals. We have to break that toxic relationship with carbohydrates, and we have to prioritize taking more and more of fruits, vegetables, pairing it up with good source of protein, and we have to prioritize taking at least 1 gram of protein per kg of body weight.
It always is go back to the basics. Get
Absolutely.
your basics straight and everything is sorted.
Yeah.
If someone has irregular periods or PCOS, what's the best first step to start feeling better?
I think it begins with proper diagnosis first. Okay, irregular periods can happen because of lot of reasons. Insulin resistance and PCOS could be only one reason. Sometimes because of underlying nutritional deficiencies like iron, B12, folic acid, magnesium, omega 3. It can also lead to irregular cycles. Thyroid conditions can also mimic as irregular cycles. So it always begins with proper diagnosis first, and then we can take it forward from there.
Okay. How can women take care of their vaginal health without using too many products?
Just by taking care of proper routine hygiene, washing it properly down there from pee hole towards butthole 2 to 3 times in a day, changing undies at least twice a day. And one life changing thing which I want to give here is that so many laundry detergents which are available in the market, they are loaded with certain fragrances that can be irritable for our vulva and the vaginal skin. So maybe we can switch to plant based laundry detergents and wash it properly down there, because see, no matter how vigilantly we wash those undies, some amount of smell is always going to be there, right? So switch to plant based detergents. I have seen countless patients of mine who used to take vaginal suppositories and tablets, something like this. Okay, and they do apply candid dusting powder, and no matter what they do, every other week prior their periods, they are going to have weird sort of itching down there. And they used to put this kind of tablets every month. Imagine. So why that itching or irritation happens? Because of such chemicals which are present in laundry detergents.
Wow. They can also be endocrine disruptors also.
Absolutely.
Okay. If a woman always feels tired, low, or anxious, what's the first thing she should check or change?
Of course, sleeping 7 to 8 hours, and then getting the basic blood panel done, like how is her hemoglobin, thyroid levels, how are her periods, how is she feeling immediately after waking up in the morning, does she exercise normally, regularly or not, these things.
Okay. Now I'm going to be asking you a bunch of questions more from a perspective of just tell us if it is truth or myth or one word answers, right? So, period pain, normal or a sign that something is off?
Sign that something is off.
Okay. Best way to track your menstrual cycle?
By making a mental note, like if today is my third day of period, so I'm going to take a mental note that I'm going to feel this way, this way, this way, and that happens almost every month.
Okay. And one food that helps hormonal balance?
There is no such thing as one food. One food alone cannot do much. Okay, there has to be a balanced diet approach that needs to follow.
Period syncing with moon cycle. Is it a coincidence or is it real?
It is real.
It is real.
Yeah.
Okay. One thing you wish women knew about their periods.
That spasmodic dysmenorrhea is not normal.
Okay. Discharge daily, normal or not?
Yes, it is normal.
Okay. Tight jeans, harmless or harmful for vaginal health?
Harmful.
Okay. One major no-no for vaginal health.
Vaginal washes and douching.
Ah.
Douching means washing the vagina from internally.
Okay.
Yeah.
It's a big no.
Yes.
Okay. Yeast infection, can stress trigger it?
Yes.
Okay. Most common myth about the vagina.
That if you are going to indulge into penetrative intercourse, or if you are going to use a menstrual cup, you are going to lose the vaginal intensity.
Oh, okay. Condoms 100% effective?
No, nothing is 100% effective.
Best contraceptive method according to you?
Barrier contraception, male condom or female condom. I am not a fan of 21-day pill. I know that will create a controversy, but still I'm going to say it. I'm not a fan of copper teas. I'm not a fan of birth control pills. See, beyond birth control option, hormonal pills are prescribed for so many other reasons. When I was pursuing my post graduation, I was having ovarian cyst in my left ovary, which was around 5 centimeter. So I was prescribed birth control pill. You won't believe, I couldn't take it for 1 month. After taking it for 12 or 13 days, I was feeling depressed without reason. Obviously, I was feeling sad during that time, but I was feeling depressed. My parents were like, 6 महीने में मेरे को 2 दिन की छुट्टी मिली थी. When I went home, my parents are like, ये हमारी लड़की है ही नहीं. I used to act really weird. And then they were like, have you started taking anything? Are you taking any medicine? So I was like, yes, my consultant has asked me to take this pill. My parents were like, you cannot take this. And I couldn't take it for a single month. Yeah, mental health repercussions are real. There are few group of women who are going to be extremely sensitive. They won't be able to take those medicines continuously.
Okay.
Yeah.
Okay. Birth control and weight gain, myth or fact?
Fact.
Okay. Sex education in schools, necessary or optional?
Necessary, without a doubt. If you are going to teach them sex education, that doesn't mean they are going to start having sex. Any which way they are going to start having sex, no matter what you are going to do. So it's better that you make them understand.
One thing young women must know before becoming sexually active.
They must take HPV vaccine.
Okay. Sugar causes PCOS, myth or fact?
Up to an extent, yes. Fact.
Okay. You can't get pregnant on your period, myth or fact?
Actually, 99% you can't get pregnant.
Okay.
Yes.
Okay. Vagina self clean, true or false?
True.
Contraceptive pills make you infertile, true or false?
False.
Okay. White discharge means always infection, true or false?
No.
Okay. So, one health trend you secretly love.
Following circadian rhythm.
Okay. Interesting. One health habit that you hate.
1200 calorie diet.
If your uterus had a voice, what would it say?
I love uterus. I love how resilient, and I just love everything about uterus.
That's amazing. And one thing every woman should start doing for her health from today onwards.
By lifting weights. Yeah, that should be necessary.
All right. Mitali, thank you so much for traveling all the way from Ahmedabad, just catching up on 3 to 4 hours of sleep and making it here. It was such a brilliant conversation to just understand with absolutely no taboo, with absolutely no kind of, what would I say, a stigma around the conversations that we had. It was a fabulous conversation. Thank you so much.
Thank you so much for having me.